So with Samaritan, a lot of people ask, are there networks of providers? And that question can mean a number of different things. The short answer is a very resounding and delightful no. You don't have to be concerned about any networks simply because Samaritan members are self-pay patients. They have their providers bill them directly. They tell their provider to send the bill to them and let the provider know they'll be paying the bills themselves. That's how Samaritan members operate, and that's how I've been operating for all these years as a Samaritan member. And so that's really kind of the really great thing in my mind. You go wherever you want. You want to go to the provider across town rather than the one who's close by. You want to go to the hospital that's 30 minutes away rather than the one over a block. Whatever it is, you like some provider, you go there. That's what's great about Samaritan. So that's the short of it, and that is really a super blessing. I know to me and my wife and to many of our members, they just love that freedom. It also means, there's somebody more naturally minded that you want to go to, and the more natural or alternative types of healthcare. And you want to go there, and it's part of a shareable need with Samaritan done by a licensed practitioner, it's great. You can go there. Samaritan has people that have, various conditions. Sometimes it's like a cancer need, and somebody, is like, well, I don't really want to do the traditional radiation, chemotherapy, surgery type thing. Some people want to, that's fine, but other people do not want to do that. And with Samaritan, you're not locked into that. You can actually go get your treatment stateside, or some people go to another country and get cancer treatment. That's shareable by Samaritan because it's being either done by a licensed practitioner or prescribed by a licensed practitioner in the first place, and they're providing a treatment plan for that alternative or natural treatment. So all that kind of stuff is there, and I'm planning on talking a little bit more about that in another video. But But as far as networks, there are no networks. You go where you want to go. Now, a few other things to note. Some people, when they ask, are there networks, what they mean is, do I take a card into my provider and then pay a copay? Because I don't want to pay $80 for a doctor visit. I want to be able to go in there and pay, $20 or $30 for a doctor visit with a copay. If that's what you mean by, is there a network, then the answer is still no, there's no network, and you do go into your provider and you pay as a self-pay patient, whatever that provider would be charging for self-pay patients. Hopefully they're doing that at a usual and customary charge. Now, the other thing related to that is that some people wonder, well, if there's no network, how do I know where to go? So that might be that's a different issue. And so hopefully you have access to the internet and you can kind of do some looking around, find out who's got, closest to 5 stars on Google or Better Business Bureau or whatever you want to do to try to find providers in your area. And there's other things, that where you can do a search and find various ratings on various kinds of providers and so forth in your area. So that would be something you can do. Your membership with Samaritan Ministries comes with a couple of different partners who can help you find providers in your area who are offering services at a low cost to self-pay patients, or letting you know where good self-pay providers are, or letting you know what the usual and customary charge should be for a particular service in your area. Samaritan has those partners that can help you find those kinds of things. You don't have to use those. So that doesn't mean there's Samaritan's network. You got to find those providers and do all. No, not at all. You want to go to the most renowned provider in the United States and go a couple states over to go there, or whatever you can. You pay the travel, but you can go wherever you want and have that shared by Samaritan. So that's all up to you. And so the other thing I'd say about what I mentioned a little bit ago with the doctor's visits, one thing about copays is they're copays. You pay that money. So if you're used to doing that with a provider, going in and paying a $30 copay, and then that takes care of their $100 visit, well, the thing about being a self-pay patient is Yeah, you might be paying that. Maybe it's a $70 visit for a self-pay patient. But the nice thing is, if that's a part of a medical need that you're having shared by Samaritan, then you're getting that money back as a part of your need. So, yeah, you have it kind of coming out of your pocket at the time of the visit, but you don't see that later. Or I should say, you do see it later from other members and get that help later. So then that $30 copay doesn't look so great in the context of a need. So really, it just depends on how you look at it. It depends on whether you're looking at it ultimately. Yes, those routine, preventative, well checked, regular kinds of office visits. Yes, those are going to be things that you'll pay on your own for the most part, and you'll be dealing with those as a self-pay patient. But the network, the freedom, or the lack of network and the freedom is really awesome. And so hopefully this video has been helpful to you. If it has, hey, put Derek Thorpe video on your application. I'd really appreciate that. If you don't know somebody who's already a member with us, and that way you can bless our family as we're helping you with this good information here, hopefully on the Samaritan FAQ channel. Thanks for watching.